Good afternoon, I'm Dr. Darcy Brunk. We're here in Dallas, Texas at my practice, Achieve Chiropractic, today. We're excited to talk about the best RSI unit and how it works in a practical application, why the technology is completely different than anything in the world, and practical applications to clinics and patients and in-home use for everyone. We're fortunate enough to have Dr. Stan Wolfe with us today. And in a moment, Stan will get into the technology side of things with you. But just wanted to introduce the use of this product to my clinic and how it's changed things. I've been in practice 17 years as a chiropractor, and we've seen all the wonderful things in chiropractic. 4 years ago, a friend of mine, a patient, introduced me to Tim Smith, who is the inventor of the best RSI technology of Avazzia. And since then, the practice has completely changed. I've been able to heal things that I've never been able to touch before, and patients bring them home and do their own applications where they are able to acquire faster results than anything I've seen in the 17 years of practice. So Stan, tell me a little bit about the best RSI. You are the creator of the RSI signal that is in the RSI, which makes this device here and that signal on the bottom like nothing else in the world.
Well, the Avazzia technology is very interesting. That even though it is a TENS unit, which stands for transcutaneous electronic nerve stimulation, that's where the difference ends between this and a regular orthodox TENS unit. Yes, the signaling is carried across the skin, but it is much different than what a standard TENS unit would employ.
Okay.
The reason why is because this is a very, very low current microamp, very high voltage, very, very short duration signal. And that is much different than a TENS unit, because a TENS unit is usually a milliamp, which means much higher current and much lower voltage. And the reason for that is first of all to get past the resistance of the skin, but also because of it's such a short duration, it goes right through the cell wall and starts stimulating different metabolic functions in the cell.
Okay, so basically the TENS units that, even the muscle stim units essentially that we've used in our practice for years, those signals don't really get in as far into there's 3 layers of fibers. Tell me about those.
Well, what the Avazzia signaling is developed to do is stimulate C fibers. Now, C fibers are the small fibers. They comprise about 85% of the nerves in the body, and they don't have what's called a myelin sheath. They're responsible for the slow burning pain. You know, when you touch your finger to the stove and you get a sharp pain and you pull back all of a sudden in an autonomic reflex, that is a very rapid, very big nerve fiber. Those are called A fibers. Those are fibers that are necessary for an immediate response. The interesting thing about C fibers is they're very slow conducting, and they secrete neuropeptides. They are a nerve fiber that's actually secretory in nature. They secrete a compound or various compounds called neuropeptides, which modulate all kinds of biological activity in the body. So really what we're doing is turning on the body's own natural pharmacy.
So that's basically where the medications are affecting that neural axonal level where all those neuropeptides are communicating. You're saying the RSI has a frequency that can get all the way to that fiber, and it's telling the body to turn on the natural things that will help it to heal, help it to feel better?
Yes.
Okay.
Now, it's interesting because there are multiple factors that turn these nerve fibers on. The first one is location. Where you put the device is going to determine what's going to be produced. The frequency that's utilized, the signaling itself actually has an effect on what's produced or how much is produced. The intensity of the signal has an effect. How often you put it on, how long you leave it on, All of these are factors that bring into play as far as how the what kind of neuropeptides are produced.
So that brings us to where we can get into some of the practical applications. My practice is very heavy athletic practice. I treat a lot of athletes. We see a lot of extremity injuries, and really a return to play is a very important part about what I do. Now, when we have an injury, of course, one of the first things we do is we apply the RSI current to that injury as quickly as we can. Cover a little bit why that negates a lot of the effects of an acute injury.
Okay. Darcy, when an injury happens and trauma occurs to tissue, the first thing the cells do when they're injured is they start releasing different type of compounds that cause inflammation. And they also signal pain to these C fibers, which are embedded more than anywhere else in the skin, in the dermis and the subdermis, the epidermis. That's one reason why you actually feel more acute pain in the skin than you do anywhere else, unless it's a internal organ that experiences a stretching type of, that's very painful as well. And what happens is those signals, those chemicals carry and stimulate what are called nociceptors, or nerve endings of these C fibers, and that carries the signal up into a ganglion, or a bundle of nerves right near the spine, and that those ganglion are actually the control center for the pain, or at least one of the first areas for the control center. And what happens is a type of neuropeptide is released called substance P. Now, substance P is a pain amplifier, and what happens is it affects the membranes of the nerves and actually opens them up and makes them more susceptible to receiving signals and carrying them up to the brain where they're perceived. Have you ever heard of beta endorphin?
Yes, sir, I have.
The athletes love beta endorphin because when they work out, they get a beta endorphin high. Well, beta endorphin is the body's natural pain reliever. It is the substance that counteracts substance P. So if you think of substance P, the neuropeptide that amplifies pain, you think of beta endorphin as the neuropeptide that dampens pain, or it turns the volume down. So if we can send a signal through the C fiber to this group of neurons or nerves bundles near the spine and say, hey, let's turn this pain down, let's create beta endorphin. And if we create a lot of beta endorphin, or stimulate the cells to create a lot of beta endorphin, then that will counteract, and it will actually turn off the production of substance P, the pain amplifier. So what you can see is we've interdicted the pain before it ever really gets into the spinal cord and is carried up the tracts to the brain where it's perceived as pain.
So the typical use on that would be to go in and use the medication, use the anti-inflammatories, the muscle relaxers, and painkillers, and that simply is doing a blockade of that signal, but it's not actually changing it. That substance P still exists, the injury still exists, and that's why you end up with, let's say, an ankle sprain or a knee that has an acute inflammation. Now, if we get the RSI device on this is what I've seen with my athletes and patients. We get that RSI device on it quickly, we see an increased circulation, increased blood flow.
Yes.
We see releases of endorphins and enkephalins and all the chemicals you talked about for pain relief. But then we also see some fibroblast accumulation in the area that enables to go after and start to attack that injured tissue, correct?
That's right. Now the interesting thing, you've actually got several things going on at the same time with the RSI, or the Avazzia technology. One of the most powerful mediators of inflammation are free radicals. And how do you quench or squelch a free radical cascade?
Electrons.
Electrons. Well, what is Avazzia? It's an electron donor. So one of the other effects that it has, actually multiple effects, is to donate electrons and squelch the inflammation by squelching free radical production. And the second thing it does is, you mentioned circulation or blood flow. It's documented in the literature that when you stimulate C fibers, you get what's called a reflex vasodilation of the area. In other words, when the C fibers are stimulated, it causes, probably mediated by nitric oxide, a vasodilation, an increased blood flow to the area, and that, along with a increased lymphatic drainage, is very beneficial for injured tissue.
Excellent. So basically, when I as a doctor carry this device, it makes me look good, because they all think I'm doing it. It's actually the technology, but we won't tell everyone that.
Well, it's actually the body that's doing it, but the technology is actually flipping the toggle switches to tell the body.
So this frequency mimics basically that of the nerve, so the body accepts this frequency and it's able to make those changes so that that healing, that pain relief, and that inflammation doesn't occur. Now, if there's already inflammation, my understanding is the technology has enough push, and it's a pulsed waveform, so the body doesn't adapt to it, so it can push through those inflammation pockets which the brain creates to try and suppress free radicals. That balloon that goes around an injured area is trying to protect the rest of the body from free radicals. This current has enough power to push through that pocket and start the healing process in that area.
I think the longer I do research and practice, the more I realize that a lot of injuries are caused by ischemia or poor blood flow, and that basically initiates a lot of this free radical cascade and a lot of the bad things that happen from trauma. So whatever we can do to increase blood flow to injured tissue is very important.
Okay, great. So now, practical application-wise, some of the things that I've seen, and you can help for our video explain what's happened. I've got a case of a 61-year-old female. She was walking with, I believe, some laundry and tripped over a box, and she fell into a dresser and basically had a comminuted fracture, just completely fractured her humerus into pieces. She ended up in the hospital. Of course, now this is, I wish it could heal something that good, but obviously she needed some rods and some pins and things in there. She had 18 screws put into her arm. This patient presented to my office, Dr. Wolfe, and she had bruising all over the back of her arm. Her incision came from about here to here. We had an RSI device with her at home. She had purchased it previously for some other chronic pain that we were treating very successfully. She was happy to have it, and as soon as she got out, she started applying it to the arm. Now, we'll have some pictures for you, and I believe I've shown you those pictures. She, from a Friday to a Monday in these pictures, had significant change. The bruising almost completely went away. One of the things we hadn't mentioned yet, the scar tissue, the scar in the area was significantly diminished, and the scar tissue seemed to be breaking down and becoming less and less. Well, tell me a little bit about that.
Let me tell you a little bit about scars. You know, what really causes scars? And I know that probably the people watching this are familiar with keloid scars, which are certain percentage of people that are cut or have an incision develop a keloid, and it's a big fat chunk of scar tissue that usually goes down into a wedge shape deeply into the tissue, into the dermis. And what happens is when these wounds start to heal up, because they have poor lymphatic drainage, the proteins, the lymph proteins, get trapped and enmeshed in the fibroblast as they come in to try to achieve closure of that wound or that tissue. So what happens, if you look at a scar closely, two things you'll notice. Normally collagen fibers are straight, or at least they have a linear pattern to them. If you look at scar tissue, what you'll see are collagen fibers that have whorls. They actually like little whirlpools. The fibers go this way and that way. They're not linear, and that makes a scar very weak. You see, the strength of tissue is when those fibers are in a linear pattern, and then they can handle the tension forces that pull, or the shear, the different types of mechanical stresses. And when you have a whirling, then that tissue is very weak. It's apt to break again if it's under tension. So what we want to do is we want to try to, first of all, get adequate lymphatic drainage from the very start, so that those lymph proteins don't get incorporated into the collagen as it's laid down by fibroblast in the healing process. If that can't be achieved and a large scar forms, then the second thing we want to try to do is, because collagen will respond to microcurrent, and actually the charges, the normal charges that are in a collagen molecule, determine its shape. If we can change the shape of the collagen molecule, basically get it to go more into a linear pattern, that will release those proteins that are entrapped within the scar. It'll also, instead of having a big volume of scar tissue with whorls and swirls, it'll bring it back into a more of a linear pattern, and that will shrink the scar.
So basically, scarred tissue is like a traffic jam. Nothing's getting through, no signals are getting through. You come in and clear out that traffic jam, that signal gets through, and everything starts
absolutely.
communicating.
Collagen, which connects almost every cell in the body, is designed to carry a positive charge. And when you'll hear different health practitioners, different people allude to blocked energy. This is blocked, or that's blocked. And it's true. What they're saying is correct. But the reason why is because the collagen fibers, some kind of injury or trauma is stored in those collagen fibers in many cases. And that is actually blocking the flow. It's not only just positive electricity, actually photons of light are carried in collagen as well. So even though maybe in the past you've heard practitioners talk about these in not so clear terms, scientific evidence now exists to show that the collagen fibers that basically make up most of the structure of our body, the soft tissue structure, does carry light and does carry microcurrent, and that when trauma or scar tissue occurs, that actually blocks the flow of light or electricity, positive electricity, through those fibers.
Okay.
In your hypothalamus, you have a template of what's normal for your body. And the nervous system actually conducts digital information to that area of the brain, and gives the hypothalamus real-time information as to the state of the body. And then what happens is the hypothalamus will respond, and what it does is it takes the real-time information, compares it with the template, and if there's a difference, the hypothalamus will respond. And what it will try to do is bring the damaged tissue or the area of a lesion back into what's normal for the template that's stored in there. Now, when that information gets blocked, healing does not take place as well. In other words, just because an injury is on your hand or in your arm doesn't mean that some of the healing doesn't take place in your mind or in your hypothalamus. The hypothalamus is actually a control center that's helping to aid that healing.
So we're healing through the brain. We're also affecting the meridians with this, because that voltage is high enough and that push is enough to get through. One of the things that I like too, of course, being in the United States, it's FDA cleared for pain treatment. I know it's CE safety approved.
Yes.
So that's excellent for the device as well. It's used in Europe, it's used in Russia, it's used all across the world basically.
You know, from the very beginning, FDA viewed this as a non-significant risk device. They realized that the safety aspect of this device was very high.
Well, I definitely think that with some of the stuff that Tim Smith from Avazzia is developing, we're going to see a lot more out of this company as we learn more, and as we see the basically electrical medicine start to take the place of typical, I guess I would say, Western approach of using medication to try and more or less cover up the symptoms and hope it heals. Being a chiropractor, that's of course important to me.
Well, anything we can do to help aid the body really heals itself. And what we're doing is we're basically giving the body some different tools and some different aids to do that.
So we're just reminding it to do what it really needs to do.
Yes, it's a much better pharmaceutical factory than we could ever begin to try to duplicate in any way, form, or fashion.
God created a good body. So I thank you for coming to be with us today. Like I said, as far as the RSI current, that's one of my favorites. Tim, thank you for your contribution to the company and what it's brought not only to the device but to my practice, so that I'm able to, as a physician, as a chiropractic doctor, access more levels of treatment for my athletes, for my elderly, and for every kind of patient that I treat. I hope that those of you watching the video, this brought you some information that gives you a good idea of what this can do for you. It's changed everything in my practice. It's made it fun again, and I look forward to what else Avazzia has in the future, because I know that their R&D department continues to work. Thank you for coming.
Thank you, Darcy.